So today I'm going to give a presentation about scoliosis. So first question is, what is scoliosis? So scoliosis is a lateral deviation in the spine, and it can also cause like frontal rotation in the spine and causing a lot of discomfort. But this deviation causes a C-shaped or an S-shaped curve in the thoracic region of the spine, which is basically part of your back that's in this region. And so sometimes these curves will go towards your shoulder blades and affect your arm range of motion. So the etiology or causes of scoliosis, a lot of times it is actually unknown. But depending on the case, it can come from other neuromuscular issues that you may have, like if someone has cerebral palsy. And then it also can come from abnormal development in the uterus, which they are unsure of what would cause the abnormal development. Different genes may call for it. So like if you have a parent that has scoliosis, more than likely like the child would have it, or if you have it, then your child may have it. Varying leg lengths, and it can also be a secondary issue such as the cerebral palsy, neurofibromatosis, and Marfan syndrome. And also it can be caused by things you do every single day. So let's say you have a backpack and you just sling it over one shoulder, and then eventually those muscles are going to try to keep your back straight and then overcompensate, and it can pull your spine over. So there are two main types of scoliosis. There's structural, which is a permanent type, and that's when people are born with it, or and they cannot be fixed unless it's caught really young, when they go in with surgery or do braces. Then there's non-structural, which is what's caused by your activities of daily living. And those can be fixed usually much easier than the structural, and usually it's exercises. So what are some of the symptoms? These are more visible signs and symptoms, but the head would be uncentered on between the shoulders. One shoulder may be higher than the other. One hip appears to be more protruding than the other. Clothes don't hang necessarily correctly off the body. Legs are uneven. And then a person with scoliosis may have numbness in their back or even in their legs due to nerve impingement, muscle weakness, and abnormal reflexes in the affected areas, but not all. So when do symptoms appear? Depending on the type of scoliosis, it can appear at different times. Structural scoliosis usually becomes more prominent during puberty, especially for girls. But it can be noticed at birth depending on how severe, or if the person has other issues along with the scoliosis. And for non-structural scoliosis, those complications occur after they've been doing things for a long time that are not necessarily proper to everyday use, like I mentioned earlier, backpack over one shoulder type deal. All right, treatment options for structural scoliosis. There are surgeries, which are bone grafts, screws, hooks, metal rods, stuff like that. They even do back braces before they go into surgery. And then exercises may help, but not necessarily going to fix it. It may just help with the pain or numbness they may feel. And then non-structural, usually exercise and physical therapy takes care of this issue. Also, avoiding activity that caused the lateral deviation in the spine is often the first treatment step. And then chiropractic adjustments can also help with this. And how to adapt for physical activity. Most people with scoliosis actually do not have physical limitations, and they can usually go about sports and activities of daily living like they usually would. unless they recently undergone surgery, then they're probably just out of activities, and if the brace is just sort of obstructing their movement. But there are some activities that they should avoid just because it needs more flexibility or has a different range of motion than they can usually do, or it's like more load on one side than the other, which is not good for somebody with scoliosis. And so some of these that should be avoided, yoga, and that's kind of iffy. It's really only certain positions in yoga that should be avoided. Gymnastics usually calls for more flexibility than they should. Ballet is not the best for their back. Figure skating, because it's a lot on like one side. Skiing and tennis, since its load is on one side. And then modifying activity. Modifications are not necessary, but may include decreased weight or load, or the usage of one side of the body, maybe. And then frequent wet rest periods in between bouts of exercise, or choosing other activities. Activities that are good for people with scoliosis include soccer, swimming, cycling, and activities that are not upper body dominant, just because it doesn't affect your back as much or jar the back as much. And that is it.